As more and more people are diagnosed with diabetes, the need for effective insulin management becomes paramount. Two popular options for managing diabetes with insulin are NPH insulin and regular insulin. However, understanding the differences between the two is crucial in selecting the most suitable treatment option for individuals. NPH insulin is a type of intermediate-acting insulin that helps control blood sugar levels over a longer duration. On the other hand, regular insulin, also known as short-acting insulin, works rapidly to control blood sugar spikes after meals. Both have their advantages and considerations when it comes to managing diabetes. In this video, we will dive into the specifics of NPH insulin versus regular insulin, exploring the benefits, potential side effects, and usage recommendations for each type. By gaining a better understanding of these insulin options, individuals with diabetes, along with their healthcare providers, can make informed decisions about their treatment plans. Stay tuned as we break down the differences and similarities between NPH insulin and regular insulin, empowering you to manage your diabetes effectively and live a healthier life. Understanding the different types of insulin. Insulin is a hormone produced by the pancreas that helps regulate blood sugar levels. For individuals with diabetes, the body either does not produce enough insulin or does not use it effectively. Insulin therapy is often necessary to manage blood sugar levels and prevent complications. There are several types of insulin available, each with its own unique characteristics and benefits. The two types we will focus on in this video are NPH insulin and regular insulin. What is NPH insulin? NPH insulin, short for neutral protamine hagedorn insulin, is an intermediate-acting insulin. It consists of insulin combined with protamine and zinc, which helps slow down the absorption of insulin into the bloodstream. This slower absorption allows NPH insulin to control blood sugar levels over a longer period compared to regular insulin. NPH insulin is typically cloudy in appearance and is usually administered through subcutaneous injection using a syringe or insulin pen. It is important to note that NPH insulin should be mixed thoroughly before each injection to ensure a consistent distribution of insulin P videos. The peak effect of NPH insulin occurs approximately 4 to 8 hours after injection, and its duration of action can last up to 24 hours. What is regular insulin? Regular insulin, also known as short-acting insulin, is a fast-acting insulin that closely mimics the insulin produced by the pancreas. It is typically clear in appearance and is administered through subcutaneous injection or an insulin pump. Regular insulin is often used to control blood sugar spikes that occur after meals. Unlike NPH insulin, regular insulin does not contain any additives that slow down its absorption. This allows it to work rapidly, with its peak effect occurring approximately 1 to 3 hours after injection. The duration of action for regular insulin is shorter compared to NPH insulin, typically lasting up to 6 hours. Differences between NPH insulin and regular insulin. While both NPH insulin and regular insulin are effective in managing diabetes, there are several key differences between the two. Duration of action. One of the main differences between NPH insulin and regular insulin is their duration of action. NPH insulin has a longer duration of action, providing a more sustained effect on blood sugar levels throughout the day. This can be beneficial for individuals who require insulin coverage for an extended period. On the other hand, regular insulin has a shorter duration of action, making it better suited for controlling post-meal blood sugar spikes. Its fast-acting nature allows for rapid blood sugar control to prevent hyperglycemia. Injection frequency. Due to the differences in duration of action, NPH insulin is typically injected once or twice a day, depending on the individual's specific needs. The slow-release nature of NPH insulin allows for a more convenient dosing schedule, reducing the number of injections required. In contrast, regular insulin is often injected multiple times a day, especially before meals. This frequent injection schedule ensures that blood sugar spikes are controlled promptly after eating. Flexibility in timing. NPH insulin provides a more flexible dosing schedule compared to regular insulin. It can be injected at different times of the day and still maintain its effectiveness in managing blood sugar levels. This flexibility allows individuals to adjust their dosing to fit their lifestyle and mealtime patterns. Regular insulin, on the other hand, needs to be timed more precisely, usually 30 minutes before a meal. This timing ensures that the insulin starts working as the blood sugar levels rise after eating. Mixing requirements. NPH insulin requires thorough mixing before each injection to ensure a consistent distribution of insulin P videos. This is because the insulin P videos tend to settle at the bottom of the vial, leading to an uneven distribution if not mixed properly. Failure to mix NPH insulin adequately can result in inconsistent blood sugar control. Regular insulin does not require mixing before each injection since it does not contain any additives. This makes it easier and more convenient to administer, especially for individuals who may have difficulty mixing the insulin. Benefits and drawbacks of NPH insulin. NPH insulin offers several benefits and considerations in diabetes management. Benefits: longer duration of action. NPH insulin provides a sustained effect on blood sugar levels, reducing the need for frequent injections. Flexibility in timing. NPH insulin can be injected at different times of the day, offering more flexibility in dosing. Lower cost. NPH insulin is often more affordable compared to other insulin options, making it an attractive choice for individuals with limited financial resources. Drawbacks. Risk of hypoglycemia. NPH insulin has a higher risk of causing low blood sugar levels compared to regular insulin. Close monitoring and proper dosing adjustments are necessary to minimize this risk. Inconsistent absorption. Due to its slower absorption, NPH insulin may not provide consistent blood sugar control for some individuals. This can result in fluctuating blood sugar levels throughout the day. Benefits and drawbacks of regular insulin. Regular insulin also offers its own set of benefits and considerations in diabetes management. Benefits: rapid blood sugar control. Regular insulin works quickly to control blood sugar spikes after meals, preventing hyperglycemia. Ease of use. Regular insulin does not require mixing before each injection, making it more convenient and straightforward to administer. Precise timing. Regular insulin can be timed more precisely before meals, ensuring optimal blood sugar control during the postprandial period. Drawbacks. Frequent injections. Regular insulin often requires multiple daily injections, which can be a burden for some individuals. Less flexibility in dosing. The timing of regular insulin injections needs to be more rigid, which may not fit everyone's lifestyle. Higher risk of hypoglycemia. Regular insulin has a higher risk of causing low blood sugar levels, especially if the timing or dosage is not accurately adjusted. How to use NPH insulin for diabetes management. When using NPH insulin for diabetes management, it is essential to follow these guidelines. Consult with your healthcare provider. Work closely with your healthcare provider to determine the appropriate dosage and injection schedule for your specific needs. Thoroughly mix the insulin. Before each injection, gently roll the vial between your palms to ensure a consistent distribution of insulin P videos. Choose the injection site. Common injection sites for NPH insulin include the abdomen, thighs, and upper arms. Rotate injection sites to prevent lipohypertrophy. Inject the insulin. Using a syringe or insulin pen, administer the injection at the recommended depth and angle. Make sure to release the skin fold after injecting the insulin. Monitor blood sugar levels. Regularly monitor your blood sugar levels to assess the effectiveness of NPH insulin and make any necessary dosing adjustments. Be aware of hypoglycemia symptoms. Familiarize yourself with the signs and symptoms of hypoglycemia and take appropriate action if low blood sugar occurs. By following these steps and staying in close communication with your healthcare provider, you can effectively manage your diabetes using NPH insulin. How to use regular insulin for diabetes management. When using regular insulin for diabetes management, consider the following recommendations. Work with your healthcare provider. Collaborate with your healthcare provider to determine the appropriate dosage and injection timing for regular insulin. Prepare the injection site. Clean the injection site with alcohol swabs and let it dry before injecting the insulin. Draw the insulin. Using a syringe or insulin pen, draw the appropriate dosage of regular insulin as prescribed by your healthcare provider. Choose the injection site. Common injection sites for regular insulin include the abdomen, thighs, and upper arms. Rotate injection sites to prevent lipohypertrophy. Inject the insulin. Insert the needle into the chosen injection site at the recommended depth and angle. Inject the insulin slowly and steadily. Monitor blood sugar levels. Regularly monitor your blood sugar levels to assess the effectiveness of regular insulin and make any necessary dosing adjustments. Take precautions during meals. Time your regular insulin injections at least 30 minutes before meals to ensure optimal blood sugar control during the postprandial period. Be vigilant for hypoglycemia. Stay alert for signs and symptoms of low blood sugar and take appropriate action if necessary. By following these guidelines and maintaining open communication with your healthcare provider, you can effectively incorporate regular insulin into your diabetes management routine. Choosing the right insulin for your needs. When it comes to choosing between NPH insulin and regular insulin, several factors should be considered. Lifestyle. Consider your daily routine, meal patterns, and preferences. If you require flexibility in dosing and timing, NPH insulin may be a better option. However, if you prefer a more structured and precise dosing schedule, regular insulin may be more suitable. Blood sugar control goals. Discuss your blood sugar control goals with your healthcare provider. If you need consistent blood sugar control throughout the day, NPH insulin may be preferred. On the other hand, if your main concern is post-meal blood sugar spikes, regular insulin may be the better choice. Cost considerations. Take into account the cost of insulin and insurance coverage. NPH insulin is often more affordable, making it a viable option for individuals with limited financial resources. Ultimately, the choice between NPH insulin and regular insulin should be made in consultation with your healthcare provider, considering your individual needs and preferences. Conclusion: NPH insulin versus regular insulin for diabetes management. In the management of diabetes, NPH insulin and regular insulin play essential roles in controlling blood sugar levels. NPH insulin offers a longer duration of action, increased flexibility in dosing, and lower cost. Regular insulin, on the other hand, provides rapid blood sugar control, ease of use, and precise timing. By understanding the differences, benefits, and drawbacks of NPH insulin and regular insulin, individuals with diabetes, along with their healthcare providers, can make informed decisions about their treatment plans. Through proper insulin management, individuals can effectively manage their diabetes and lead healthier lives. Remember, always consult with your healthcare provider to determine the most suitable insulin therapy for your specific needs. With the right treatment plan, you can take control of your diabetes and live a fulfilling life.